I have a lot of questions myself about mental health.
You should you should send them. You should send them in and see if we can answer them.
No, I
Anonymous.
won't. I won't stuff the ballot box. Let's let the folks who are listening do your thing and send us some questions. Welcome back to Shrinking It Down, Mental Health Made Simple. I'm Beresin.
And I'm Khadijah Booth Watkins.
And we're two child and adolescent psychiatrists at the Clay Center for Young Healthy Minds at the Massachusetts General Hospital. And this is our first episode, I think, of our podcast for this year, isn't it?
This is our first episode for 2023.
And we're going to begin in kind of an open-ended fashion because your questions are super important to us. And even though we believe that we're experts, I guess we are experts in child and adolescent psychiatry, you're experts with your kids. And you have questions based on real life experience that are so important. So we're going to start this year with answering some questions that you've sent us. How does that sound, Khadijah?
Sounds like a great idea. And I tell parents all the time, like, I'm an expert in my own right, but you are the expert on your child.
Exactly. So maybe I'll read the first question and then you could, chime in. Okay. It's how to help with hair pulling. I guess it's as simple as that. There wasn't a follow-up. So
how do we help with hair pulling?
Well, first of all, I'll open it up. Hair pulling is called trichotillomania, which is a variant and related to obsessive compulsive disorder. And it's defined as twisting, pulling, and sometimes even pulling out your hair. And it is a bona fide compulsion that a child just can't stop doing. So, Khadijah, what do we do for that?
Well, we can think of just some practical ways just to address the act of hair pulling. And so some things that I sometimes recommend are, if they're pulling hair off the top of their head, recommend wearing a bandana or some sort of hair covering to make it more difficult. Sometimes kids can get really, they can get bald spots, which make it hard for them to feel good about themselves and confident. Other things that I might recommend would be maybe wearing gloves. Sometimes even something as silly as maybe putting a little bit of Vaseline on the tips of your fingers because it makes it hard to grasp the hair and pull it. But the one thing that I do also recommend while we're doing these acts is to think about, when do you hair pull? Do you pull your hair when you're bored? Do you pull your hair when you're trying to go to sleep at night? Do you pull your hair when you're stressed? Or is it hard for you to know? But this might be a cue or a clue to help us to think about how we might kind of give you other interventions to address it. What else should we think about?
Well, what I'd like to know also from the standpoint of the child is whether it's felt to be a negative experience or whether it gives them some degree of pleasure. A lot of obsessive compulsive behavior is meant to fend something off. In other words, you have a compulsion to, touch the door 3 times or say 3 prayers or, check to see that the stove is off, and then you check again and check again and check again. And a lot of compulsive behavior is meant to kind of either ward off something bad happening or make yourself feel better in a weird way, even though you can't stop. And in that light, if we think of it as a variant of obsessive compulsive disorder, the 2 mainstay treatments that we provide is first cognitive behavior therapy, which helps teach the child what to do about thoughts, because usually it begins with the thought of pulling the hair. So you have a trigger, and that's the impulse. You have the thought, and that's of twisting or pulling out the hair. Then you have an emotional reaction, which is anxiety. I just got to do this. It won't be relieved until it's done. And then the behavior, which is the hair pulling. So working on exaggerated or distorted thoughts or cognitions is what we do for cognitive behavior therapy. And the other part of it is using medications, because the selective serotonin reuptake inhibitors, the SSRIs, have been extremely effective in treating OCD, even up to 85% effective, and especially when combined with cognitive behavior therapy, with CBT. So those would be the traditional methods that we would provide as doctors.
I think those are really great. And I think that brings us back to why the why is so important, because I think it helps us to tailor the intervention specific to the kids. Because I could tell you, to sit on your hands or to, keep a fidget. But if hair pulling relieves distress, I'm going to also probably create some distress. So really understanding why you're doing what you're doing is going to be so important to help really tailor their intervention to really, get the symptoms to go away or get the compulsion to go away.
Great. So let's tackle the second question. The second one is how to help my teen son with avoidance behaviors at school and at home.
Avoidance is a symptom, I guess, of so many different things. And it goes back to what's the function of the behavior is what I like to think about and discuss with parents and kids. Because if we can understand the function of the behavior, we can begin to do things to kind of undo it. And most of the time, we avoid things if it gives us distress or makes us uncomfortable. If I'm afraid of heights, I'm going to avoid, going into elevators or going over bridges. So really understanding the function of the behavior or why we're doing what we're doing helps us to think about how we would begin to build an intervention to help address it, because we got to go to school, you got to come home. And so these are things that we kind of have to do. So how do we help them do it in a way that is less distressful?
Yeah. And to add to that, we want to know what they're avoiding. I mean, so are they avoid? So all of this is involved in having conversations, which we promote and which are super important. And I'd like to know, what is the child, what is this little guy or teenager avoiding? Is he avoiding social situations? Is he avoiding homework? Is he avoiding going to school? Is he avoiding public speaking in class? Is he avoiding playing sports? And because once we know what the avoidance is, we can add to what you're just saying, and we can begin to think about how do we address that problem.
Most of the time, it's going to be some form of exposure response prevention. So we're going to try to gradually expose them to what they're avoiding to hopefully let them see that, it's not so bad. We survived this, for 10 minutes. Let's do it again for 30 minutes. But hopefully, over the course of time, as we gradually expose them to what they're avoiding, they become desensitized to it, or they become kind of, if you will, immune to what they were originally afraid of. And then it becomes easier for them to do. But it's so important to know if we're exposing them to, if they're struggling with the schoolwork, we need to get them help with whatever accommodations or remediation they might need. If they're being bullied at school, we need to address that. There's the safety concern. So we do have to have these conversations with them and make it a platform that feels open and safe for them to share exactly what they're feeling and exactly what's going on with them when they go to school or when they're going home that makes it so difficult.
And when you said exposure response prevention, that means exposing them. It's a form of CBT. So we like to expose them in baby steps. So if you're afraid of heights, you don't go to the top of the Boston, the Hancock Tower, for New York, the top of the Empire State Building, and look over the edge. That's known as flooding, and it's actually more traumatic than doing it step by step. We used to call it systematic desensitization, which means you systematically desensitize the child to whatever they're afraid of. And usually avoidance is a fear response. It's part of the fight or flight response. So instead of fighting, they flee, they avoid it. And a small step-by-step approach is what we typically use for for phobias or things that we're afraid of. The other thing I want to mention about this is that I would try to understand empathically the child's feelings and point of view. I mean, if they're avoiding schoolwork because they have a learning disability, or if they're avoiding social situations because they're afraid of saying something wrong, or they're afraid of bullies, you know, one of the things we don't want to do is say, well, just do it. You know,
Just suck it up, buttercup. We don't want to say that.
no, and understand, why it's so difficult. Because once you have an understanding of the child, and the child feels that he's being seen, heard, validated, that you get it, and he's got that support. I mean, it's very, very hard to face a fear, even if that fear is irrational. Now, bullying is not irrational. Bullying it's an aggressive thing. But let's say he's afraid of kind of like giving a book report in class, and you might think, ugh, how ridiculous. Well,
back in my day, this was never an issue. Just do it.
Right. You just did it, and that's it. You got it over with. You sucked it up, and okay. So, and it may end up being that way to an extent, step by step, but it's so much easier for the child to engage in that stepwise progression if he feels that you get it, and that you're supportive, and that you understand, and you're not criticizing him for a deficit. We all have our weaknesses, and we all have our strengths. And I think everybody listening probably can think of something that they've been afraid of, that they've avoided.
Like my emails after vacation. I mean, the other thing I will add is that it is so important to address it sooner rather than later and begin having these conversations, because the longer we engage in some sort of avoidant behavior, the harder it is to re-engage in it. So the longer they might, resist participating in class or going to school or doing things that they're supposed to do around the house, the harder it is for them to go back to it. And so, again, having these conversations as soon as it appears to be potentially a problem, and thinking about ways that you can help gently and warmly push them to their goals.
Yes. We don't want to make the molehill into the mountain, right? So that's a good point. Okay, so we have a third one. My child recently started touching the edges of furniture, picture frames, objects around the house whenever they get up to walk somewhere. They don't seem to be aware that they're doing it, and they can't seem to stop when I ask them to.
This one is a little bit trickier, because it could be like you talked about earlier about what is the sensation or feeling that they're getting. Are they getting some sort of relief, or is it just like an automatic act, almost like a tick, like an urge?
It does sound very much like compulsive behavior, and very much like what we talked about with hair pulling, except this compulsion is one of touching.
And you might find after you have conversations that there is some sense of relief, and they may be a little bit more aware of what they're doing. It may not be as straightforward as it seems to appear right off the bat.
What's interesting about this is that they don't seem to be aware that they're doing it. Usually with a compulsion, folks, kids as well as adults are very aware of what they're doing. They just can't stop it. In other words, they have to, they have to open and close the lock on the door 3 times, and they're aware that they're doing it, but they just can't stop themselves. So what's interesting about this is that they don't is the lack of awareness, which enables
they're not aware.
Well, that's right. The parent. So that's where conversation comes in. Asking them, "Are you aware of what you're doing when when you're walking around the house?" And then the other question I want to know is, do they only do it at home, or do they do it everywhere? If they do it at home, I mean, there's meaning behavior has meaning, even if we just don't get it at first. If they're just doing it at home and not in restaurants or in supermarkets or in school or in their Sunday school, wherever, then what is it about home that makes them have that urge? So that's kind of, parents, I think, need to be kind of like, detectives in a gentle, warm way, understanding.
We have to be mindful of our body language and our tone when we ask questions. The words that we choose when we ask questions, like why, is really a tough one, because it usually always comes across typically judgmental, and often if I knew why, I wouldn't do it. And so asking why is probably not the best way, but like, what do you think? What's going on in your head when this happens? Are you having a certain feeling? Like asking more questions more specifically and directly can be more helpful. But as long as we're coming to this again with warmth and kindness and compassion, we're going to be successful. We just have to be patient and ask questions and have multiple conversations, because they might be a little bit embarrassed and ashamed at first. And they might initially say, what are you talking about? I'm not touching the corners. That was just one time. But, going back to them and asking, expressing that you might be, that you're concerned, like all of these things can help open up the floor for them to feel more comfortable and supported.
And I think to understand that, as Stuart Avalon, I think kids, always says about kids who are challenging, is that it's not it's not willfulness, it's a lack of skill. They are not willfully touching these things because it's fun. They just don't have the skills or the understanding or the mechanism or the means to stop it. So taking an approach to understand them and decide with them and to support them and to manage it together. The good news is that the behavior is an obsessive compulsive disorder, which is what I assume this is a variant of, are incredibly rewarding for us to and for parents to treat, because these kids, most kids get better, much better. Okay. So we have another question. How do we better support our 5-year-old who was fully potty trained pre-pandemic, was out of daycare for 10 plus months, and has since struggled to keep her underwear dry, especially when watching TV? Pediatrician has already checked for medical causes and she does not wet the bed. This is a consistent after school with parents, primarily a home thing, purely based on FOMO, or fear of missing out. She screams at us when we prompt her, and she's begun to lie and attempt to hide the behavior. But unfortunately, mom's nose knows and can smell it. Consequences have resulted in repeated loss of screen privileges and leaving the end of play dates early when movies or TV shows are involved. Have also asked her to rinse her own wet clothes. Please help.
I mean, there are a lot of layers here that I think we probably will have to unpack and talk through step by step. And I can imagine it sounds like the mom is kind of at a loss, obviously, for what to do, which is hopefully we can be helpful around beginning to think through this with her. I think the most important thing is to make sure that there's not a medical cause, which it sounds like she did. What are your thoughts?
Well, I have a lot of thoughts. First of all, I think if I were to approach this clinically, I would want to know, has anything changed at home? Things like this don't necessarily come out of the blue. Has there been a change in jobs, in the parental relationships with siblings? Have there been other adverse events? For example, has anyone gotten very sick from COVID? Has anyone died? There have been losses. So I think we start by asking some general questions about what home life has been like. What's fascinating to me about it is that it doesn't happen in school. It doesn't seem to happen. It doesn't happen at night. So something's happening, particularly around the screen. So Khadijah, what would you ask about the screen? About what, or any other questions? What would you ask about?
So I would start to think about like, what is the function of this behavior? What is this doing for her? Obviously, this is not something she's doing in a way, something because she wants to. I think we want to be clear about how we approach it and really manage, be mindful of the thoughts that we're thinking. So we don't want to think about this as something that's willful. We want to think about how this behavior is serving her. And so mom mentioned that there's fear of missing out. What is she maybe so captivated by on these screens? How can we maybe think about breaking it up a little bit more so that there are more natural breaks? Is my first thought.
Yeah, and I want to take off on what you said about it's not willful. I mean, this reminds me of some basic principles of collaborative problem solving, and that is that her behavior. All kids want approval, and so does she. And as we know from Stuart Avalon and Think Kids, it's not a matter of willfulness; it's a matter of lack of skills. But one of the things that also happens with collaborative problem solving is that you get further with kids, I think, rather than using punishments to change behavior, such as taking things away, like the screen time, like taking her away from play dates early so that she won't watch TV, like making her rinse or wash her own clothes. Those punishment measures typically don't work as well as using positive reinforcement. So, for example, how can we make this into a win-win? How can we talk with this 5-year-old and say, look, I don't want you to poop in your pants. I don't want you to miss TV. If you've got to go, can you raise your hand, or can you come over can you hit a bell? Can you tell me you'd like something to be stopped? And then we'll just pause the TV and you can continue with it. And rewards work better than punishments. So, you could negotiate. If you can watch this show and not miss out on anything, but poop in the potty, and we can put a potty right next to the TV so that you don't go in your pants, what would that be like?
And that's how I potty trained my son.
Oh, really?
The potty, we walked around with the potty for 2 days.
Well, that's the way it typically, I mean, this is a regression. Most parents have potties that are movable, that are easily accessible. So why not? My concern is that by using punishments rather than rewards, we're making the kid feel bad about herself, and it could be done in a very different way.
So just to kind of continue on this for a little bit. So I do think that obviously positive reinforcement, praise gets us further for sure. I would wonder if the goal of having her leave play dates early is really to spare her embarrassment, because maybe mom is afraid she's going to have an accident. And I think that might be okay temporarily, but I think maybe, every 5-year-old is different and their ability to kind of communicate is different. But if she's able to talk a little bit more about what is happening when she has an accident, what prevents her from getting to the bathroom, does she notice the sensation of needing to go? She might tell you that she is afraid that she won't finish her show, or that, by the time she's finished going to the bathroom, her TV time will be up. So maybe being able to, in advance, reassure her that if you go to the bathroom, you won't lose your time. Being able to proactively address her concerns. And then with that, I think whatever plan is created, whether we're going to have breaks every 15 minutes or whatever plan is created to get her to go, to retrain her to go to the bathroom, that being discussed in advance will, I think, also be much easier for her to tolerate, and have her weigh in terms of the planning, have her collaborate with you. I know she's 5, but have her give her thoughts about like what this plan could look like and what she might be able to earn if she could successfully, go to the bathroom 3 times during a show or whatever is reasonable. I don't know. But think about how we can motivate and incentivize her to do what it is we need her to do and what's in her best interest.
And you're right. I think, for example, if she were to do that a number of times and not miss out on the show, maybe she gets an extra reward.
And the trick is really figuring out what plan you can come up with that you can, as the parent, be consistent with, because that's going to be really detrimental to the process if you're not able to be consistent. So pick something you can be consistent with, pick rewards that you can easily also be consistent with. And they don't all have to be monetary rewards. Like they could be extra time on a screen, or, an extra fun activity at the end of the night. It could be staying up, 5 minutes later. Just be creative about the rewards. And again, engage her in the discussion about what the rewards might be. But I think really thinking about what you can create that you can stick to, because consistency is going to be key to the success of any plan that you come up with.
And just for the record, I said pooping. It may not be pooping. It may be that she's just got to go pee, but doesn't want to miss it. And you can't hold it in that long. I mean,
And that's not uncommon, where kids don't want to interrupt their show. They don't want to interrupt their game. They get so engrossed that they don't want to miss out. Some kids, for whatever reason, don't notice the sensation or the urge that they have to go to the bathroom. So that's something else, helping them to figure out helping them to become more mindful and more aware. And so every kid is different. So we really do have to take the time to figure out what is happening with her specifically, so that we can kind of tailor an intervention that we can hope to be successful. And I think we should lead with that, because most of the things that we are talking about and most of the things that parents bring to us, they're often highly treatable. And it just is a matter of getting the information, getting the education, and being pointed in the right direction.
And on that note, we can end with this, and that is that the myth about psychiatric disorders is that they are not curable, that they're not treatable, that you're just stuck. And the fact of the matter is that most medical disorders are not curable. When I was a medical student, I was told by one of my attendings that there are only 2 cures in medicine: surgery and antibiotics, and everything else is just maintenance. And whether it's ulcers or migraines or lower back pain or whatever, hypertension, we basically have treatments that are effective in kind of controlling things. In psychiatry, we're batting at about 70%, which is as good as it gets in almost every other medical disorder. And there are only a small handful of psychiatric disorders that are much more difficult to treat and to get what we call remission. So I just want everyone to know that psychiatry is no different than the rest of modern medicine, and that we really do have effective ways of taking care of things. So on that note, we'd like to, we hope that our conversation and our questions will help you have yours, and we hope that you'll ask more questions. These were great. And just send them in, and we'll try to weave them into our podcasts this year. I'm Gene Beresin.
I'm Khadijah Booth Watkins. Thank you for listening.
Is this our first episode? Is this our first episode?
Welcome back.
Okay.
Welcome back. Welcome back.
I don't.
Welcome back.
That's a great song. John Sebastian
See, I knew you
wrote
would
that.
like it.